So if someone's complaining of hip or knee pain, the first thing Dr. Stram's going to do is get x-rays. So that way he can see, sometimes they may be complaining about back pain or hip pain, and it could be related to their knee or their hip. So he's got to do some x-rays and figure out what's going on, if they have osteoarthritis or what they have. And then after he's talked with them, if he thinks surgery is appropriate, he'll go over alternatives to surgery, because surgery is always the last option.
When you come and visit with me here in the office, the first thing that we'll do is we'll talk about your history. We'll review the things that you've tried. So once we've decided that the surgical pathway is the path for you, we will schedule the date for surgery. And before that happens, there are lots of things to do. Those things include visiting with your primary care physician to make sure that your heart and lungs are in the best shape that they can be before surgery. You have a preoperative educational meeting or joint camp where you'll meet with people that will help you in the hospital. They'll go through the whole process with you, so you'll know exactly what's going to happen from the moment you arrive to the hospital, from the moment you leave. So their job is to help you feel comfortable about the decision you've made.
Then they'll come here about a week before their surgery to the hospital, and they'll meet with myself, they'll meet with Dr. Sterdam's physician assistant, Nathan Baines, and they'll meet with the preoperative nurse. So that day consists of a lot of education, really preparing the patient for surgery. A patient that has a lot of education ahead of time and knows what to expect usually has better outcomes. That way we can tell them and their loved ones what to expect. So we encourage them to bring someone with them, because it's a lot of information.
On the day of surgery, I'll meet with you in the preoperative holding area. You'll meet your anesthesiologist. We'll mark the correct extremity. Surgery usually takes about an hour and a half or 2 hours. Once surgery has been completed, you go to the post-anesthesia care unit or the recovery room, where you typically recover about 90 minutes or so. And then once that has been accomplished, you're transferred up to the orthopedic wing.
We do everything we can while they're here in the hospital to prepare them for home. As far as exercises that they'll do here, they'll give them home exercises at home. We'll make sure we get them on the right pain medication, that their pain's well controlled in the hospital. That way when they go home, their pain's well controlled. And again, just give them some education on what to expect when they arrive home.
We tailor the Joint Experience program to each patient individually. So depending on what your personal circumstance is, we try and make it so that you're comfortable with every decision that we make along the way. That may mean that you go home the day after surgery, or it may mean that you go home the third day after surgery. We try and enhance your experience and really try and point you in the direction where we feel like you're going to end up with the best possible outcome. So there are lots of options for when you go home. Typically, a patient will have outpatient physical therapy 2 to 3 times a week, depending on their progress, and we'll check on them at a month after surgery, 2 months after surgery, and then typically at 6 months after surgery, and then annually thereafter. The outpatient program is, again, prescribed for each patient individually. Over the last decade, I've been very proud of the progress that we've made at IU Health Bloomington. We've been able to basically take a community hospital and carve out a wing or a division that's basically dedicated to joint replacement surgery. And now we have a specialized unit, specialized therapists, specialized nurses that are all there and dedicated to your successful recovery.
Patients that choose to come to IU Health Bloomington, the reason they should choose our hospital is because our staff is very well trained. Dr. Sterdam has worked very hard to make sure that staff is up to date on the latest things for joint replacement, that we're all on the same page as far as how therapy should go, how their pain should be well controlled. And we're actually a joint certified hospital. We're certified in both hip and knee replacements, and we're only one of 4 hospitals in the state of Indiana that have that certification. So that just shows that we've done the work and that we have great outcomes in order to obtain that certification.